So we're here with a guest today, Joanna, and she's going to be talking to us a little bit more about the science and information and the services she provides in terms of thermography screening. So first off, this is not going to be promotion of do this cancer screening instead of their cancer screening. And I'll talk about a little bit of concepts beforehand, and then we'll get right into it. We've got a couple questions already asked online, so we're excited to do that. First question, though. How'd you get started in thermography? Like, what led you to this?
So my husband and I have, do you mean like a you or them?
I don't.
Doesn't matter.
We're in a conversation.
Yes.
We're just doing life conversation. These innocent bystanders
Happen to
get
be
blessed
a part of
with
it.
information online as they watch.
Okay, cool. So that's funny. So my husband and I have been really crunchy for a long time.
Yeah.
And people have always come and asked, why do you do this? Or how do you do this? Or that sort of thing. And
You good on sound?
about 3 years ago, I had thermography done. And honestly, the first time I did it, I was like, Like, it just wasn't that interesting to me.
Yeah.
It looked a little bit uneven, but it just didn't scream at me. It didn't tell me anything that I didn't kind of already know. And then I started doing a 7-minute workout in addition to what I had already been doing, which is nothing, 7 minutes. And then I started dry brushing and I started drinking more water, which I don't even know how that's possible. Yeah. But after 3 months, I went back and I was like, I'll just see. It went from super uneven to completely symmetrical, which is what we're looking for.
Yeah.
And that's how the body should work. And so I kind of firing went off. I was like, okay, so tiny little lifestyle changes can make this much difference in my body that I was already eating pretty clean. I was already, mostly doing the things, and it totally adjusted it. So I was pretty hooked.
Nice.
That's awesome. Yeah. That's fun.
What's up? Hometown best friend is on too, Nick.
Ooh.
Or is that his wife on right now?
Or Mindy.
Mindy. What's up? How you guys doing? So that's cool. That's cool. So it was just kind of like you went in it slowly, gradually, and we're like, okay, let's add in a couple simple lifestyle changes. And that's what's the beauty of this is I feel that thermography could be used in a situation in almost anybody's life. And then again, I want to touch on what we touched on beforehand is that it's not a tit for tat, flip flop switch. But it's something that can be applied and then something that can be like, hey, okay, I see some asymmetry here.
Yes.
And that's really what thermography is looking for is asymmetry, which it could pick up like, why are you super hot on both sides? Why is there inflammation bilateral? That type of thing. It could indicate things but it's rare that inflammation is going to be exactly the same pattern bilateral. But it could be light a fire. Inflammation, pun intended. The inflammation, the finding of inflammation on your thermography could be something to light a fire underneath your rear end. And that enables somebody to say, hey, I need to start doing something and change the lifestyle. I need to add in lifestyle factors that I should have had there many times on already, And then finding other areas like the dry brushing and different types of exercises and lymph movement, that type of thing that can help them more than... Because it sounded like you were already crunchy. You were already doing some things.
Yeah.
Healthy wise. And you're like, okay, so there's more that I can add to specific for your body and your body's need at the time, right?
Mm-hmm. I feel like that's super beneficial to even for people that are, maybe even more so for people that do think that they're healthy and doing all the right things. Like even myself doing the testing within the office and you think, oh, well, that won't be me. And you see that. You see that within the natural healthcare community of all these people that are big within the natural healthcare community. Charles Majors, like there's so many people that it's unfortunate, but it happens to because you think, oh, I'm doing all the right things pretty much, and I should be healthy. And nothing's going to happen to me. And that's not always the case. You could be missing a little something.
Like, my mentor and friend, my Dr. Majors, he, passed on brain tumor, beat it for way longer than they would have ever expected anybody. It's usually like less than a year mortality rate. And like, I forget how many years that he survived. But he was into bodybuilding. He was into weightlifting. He used steroids, So, he did some things that are extremely detrimental to his system and his body and very toxifying. So, and that's the majority of us. The majority of us didn't live completely healthy lives from the get-go. And the reality is what we're exposed to is outside of our control.
Yes.
Right.
The government plays a part in that. Industries play a part in that. I mean, we fought to try and stop a lead battery factory from being put here in Clarksville, and no, we're only going to release 1,000 pounds of lead into the atmosphere, and that'll be it. You'll be just safe. And we're going to put low income housing right downwind from this factory. Yeah, you're really looking out for people. At least that's what I've heard they're going to be doing with those. Yeah.
I'm not sure.
Off on a tangent. There we go.
Yep.
But let's concept first. Here we go, and we're going to get into it a little bit more in depth. We'll come back to this image, but it's again how simple and effective thermography is. It's picture perfect. You can accidentally detect breast cancer with thermography or a thermal image at a museum. Right? Yeah. It was literally an accidental. Yeah, but it led her, and that's reality. Like I think one concept you wanted to touch on was that it's not a detection. It's not a test to look for breast cancer. That's not what you're looking for. Right. You could be led down a testing path that can indicate that you're in full blown active cancer. Mm-hmm. But what I want people to think about first is that this type of test is to see where you're at. It's not why you're there. Okay, it doesn't tell you why you've got the disease process, why you have the inflammation, why you have the blood vessel or lymph system issue that can be indicative of a disease process taking place, possibly full bore into cancer, or it could be preliminary or before that. So you got to figure out why you're there so that you can effectively reduce your risk of death, mortality, full-blown cancer, those types of things. You got to do the right, if testing is necessary to figure out why you're there, you need to do those tests to figure out why you have those imbalances. Mm-hmm. Yep. So, but tell us a little bit more maybe from your perspective and maybe what, because the FDA says you can't advertise it for breast cancer detection. So anything along those lines that you want to share with people? Yeah,
I love thermography because it is a great tool to just motivate you to change your lifestyle.
Yeah.
I have seen lots of interesting things. I just showed you guys some pictures of somebody who had implants. Mm-hmm. She had a ton of inflammation between her breasts, which I didn't even notice the first time because she was so mobile. She was moving a ton during the testing. And so I was like, I don't know, maybe she's just excitable and just has inflammation. But it was really rough. When she had the implants out, that inflammation was gone. And I just didn't realize she was feeling horrible.
Yeah.
And she had been feeling horrible for months and just couldn't quite figure it out.
Mm-hmm.
And so after they took them out, she realized that they were like rotting in her body. And I mean, just so ew.
Yeah.
And she had been doing tons of hot yoga and other
doing things that
so bad.
Yeah. Tons of those sort of things that just weren't helping either. And so that was
so she was mobilizing more toxins into her bloodstream by doing hot yoga and other things while having a toxic source within her body.
Yeah. All the things
that's what breast plants are.
Yeah.
Implants are.
Gosh.
Breast plants.
I had so many, I did not even correlate that up until, I never correlated it with the implants until like probably 8 years after I went through my hot yoga stint.
Yes. Yeah.
And being told that I shouldn't detox. And I was like, so that's why I literally felt like death for about 2 days after every single time I went. Mm-hmm. I loved it while I was in it, while I was doing it. Yeah. But my body did not love it.
It felt good. It mentally said, I'm doing good by my body. I'm sweating stuff out. And
Yeah, I'm really bummed that I didn't think to do this prior to because
that'd be cool. Those pictures would be really cool.
Awesome. Yeah.
Well, that was one of the reasons we did the allergy testing. So she was allergic to silicone. Mm-hmm. Yeah. So, just it was more like, okay, are you there? We're getting them out no matter what because they're toxic to the body no matter whether you're allergic to them or not. But but it's kind of like where you're at testing rather than why you're there. Yes. Now, allergy could, for some, can be like, oh, I'm allergic to it, so I have to get them out now.
Sure.
And it could be a great excuse to some of the ladies out there whose husbands aren't on board with you. Oh, thermography could be, hey, you have major inflammation in your breast tissue. Yeah. Like, husbands, you might like them a little bit larger, but the reality is, guess what? If your wife has to go through chemotherapy, radiation, and maybe more invasive procedures, or be chronically fatigued and things like that, all because of inflammation in her system, I'd rather have a wife that's super high energy and excited and happy-go-lucky and not dealing with anxiety and some of the mental health aspects. I mean, you dealt with anxiety, so that lady probably that was breast implant, high inflammation. Inflammation can negatively affect the brain.
Yes.
And I've seen that in kids with ADHD and things like that. So it's like, get rid of the inflammatory source, the source of the inflammation, and they can calm down, settle down. She's probably all over the place because she couldn't sit still. Maybe inflammation of the brain.
Yes.
So let me talk about that, and then you need to make sure that we touch on since it was kind of on the breast implants there for a little bit, about why you're not supposed to do mammography if you have breast implants. But I wanted to utilize a piece of research here that I like to reference all the time. And this was a really good research study because it looked at 2 large countries that have really good data in terms of breast cancer mortality. This is British Medical Journal, so this is a PubMed article. It's a major research journal. And you'll see graph-wise, which Anthony and them, they can throw it up on the screen, right?
Yeah, it's on the screen.
Okay.
It's already on the screen. So you're going to see Norway, thicker lines being the mortality rate. Thinner lines are going to be your screening rate. So what you'll see there from 1980 all the way to 2006 is you look at the mortality rate in both of these countries kind of stays relatively the same in both nations. And then when you see that very small line just go skyrocketing up in Sweden, you look at it skyrocketed up roughly mid-1980s. And the rate of screening went way, way up. So the percentage of women going for annual mammography screening, it went up even more in the late 1990s and early 2000s in Norway. But you do not see, you should have seen an exponential decline. You should have been a sharp step off. You should have seen a decline in the mortality rate right after a massive jump in screening rates. So that graph in that British Medical Journal really shows you that. You can grab that, read it for yourself. And really, Anthony, go back on us. If you take that and then you apply it here with thermography, while thermography is not a detection of breast cancer, neither is mammography. Mammography is a detection of abnormal tissue growth, increased density of tissue, so a lump, which again could be many different things. It's not going to diagnose you with breast cancer because of it. So mammography isn't even technically for the diagnosis of breast cancer. It's to detect the possibility of breast cancer, and then other testing has to take place to full on diagnose a woman with breast cancer. So even if we were to swap everything in America, every single mammography, detection center or facility throws those things in the trash and then adopts thermography, but we do nothing about taking care of the reasons why you're there. And I'm saying that again, if you're just joining us, I was saying that thermography and mammography, whether either of them, that testing, thermography being better in the way that it doesn't cause you to have cancer. It doesn't cause you radiation exposure. It doesn't cause you tissue damage. It doesn't cause you to have more inflammation in your system. These are tests of where you're at rather than why you're there. And you need to figure out why you've gotten where you're at. If any type of test, whether it be mammography or thermography, you need to figure out why you're there, because that leads you down the path to true healing. And that's what we want you to take from this.
Right.
So again, you swap out all of the mammography screening in America for thermography. Yeah, we're technically better off because, again, the National Cancer Institute, in fact, says that for every 1,000 women going to mammography, they get, and I'm pulling this stuff up on the screen. This is the National Cancer Institute saying that the magnitude of cancer because of mammography is 1 in 1,000 women who go to annual mammograms gets cancer because she went and got radiated year after year.
Right.
And sadly, if you look at the compiling, the compilation, the majority of their science, you look at the Cochrane Database of Systematic Reviews said in 2013 that they would have to screen 2,000 women yearly for 10 years to decrease one woman from quote unquote dying of cancer. But do those numbers. The National Cancer Institute says 1 in 1,000 will get cancer because of mammography. And then the science really only says 1 in 2,000 will have their life extended. So we're one in the hole there.
Yeah.
So we've had more women develop breast cancer because of mammography than we're saving from breast cancer with mammography screening. So we are harming with radiating breast tissue year after year. We know that that is a fact. I mean, they say that for every life saved, they're going to put 10 women through treatments for breast cancer that should have never been put through the rigmarole if they never would have gotten mammography screening. But again, you just can't swap. You have to, it would be better off, but yet we don't want you to just stay in that same medical mindset. If you came in on the 28th, you're going to be here all day long doing thermography screening. And it can be thermography of breast tissue. It can be thermography of lymph system, of thyroid. It could be thermography of your spine if you want to do that, of back problems. It could be you've got a knee issue and you see if it's an inflammatory in nature. You can do that. I mean, you could look at rheumatoid arthritis type factors. Why are your joints in your hand always swollen and painful? So it could be anywhere.
Yeah.
They'll be able to select. And obviously October is more breast cancer kind of.
Right.
We're using that. We're piggybacking off of it to bring you additional information to this subject. But we want you to take the information and figure out why you're there, not just run out of this office and into the hands of the medical community and just have your breasts cut off. Because again, the rates of deadly types of cancer like lung cancer have gone up more than what breast cancer has gone down. And again, if you cut more women's breasts off, then they're less likely to be diagnosed with breast cancer and die from breast cancer. But their risk of lung cancer is still there, actually oftentimes higher if they went through chemoradiation. So
what you said this morning, I thought was really good. Just that if we don't change our perception of what we do whenever we get those test results, then nothing's changed. You've just radiated yourself less, but nothing's changing. So you really have to change your perception. We have a different perspective.
Give us another cool kind of what you've experienced providing the service to the community. What is a cool kind of maybe a testimony or something?
Sure. So there was a question here about what were the before and after pictures that you posted.
Yep.
And that woman had come in and she's actually a provider. So she's in the more crunchy set.
Yeah.
And she already lives the lifestyle and she didn't realize she just had a lot of inflammation.
Yeah.
And she had a lot of lymph congestion. And so she decided to do some dry brushing, moved her body a little more. She didn't make major changes, just a few little things. And started drinking more water. I think she did one other thing, but I can't remember what that was. So very tiny
I think you said it maybe remove gluten or something like that.
Yeah, there was some food thing.
Yeah.
And man, she came back in 3 months later and looked amazing.
Yeah.
Nice. The inflammation had gone down so much. So I even think just using it as the motivation tool is so good. And like I was telling you guys earlier, there was one woman who came in and I could see definitely that she had a little bit more inflammation on one breast than the other. Mm-hmm. And it was even a little bit square shaped. And so I was like, that's weird. That's not normal.
Yeah.
And so I was asking her, do you ever hold your phone in your breast? Bra. And sure enough, she did. And so yes.
Yeah.
And so I asked, well, where is it? And I can't see her because there's a curtain between she and I, but I can see her picture. And she's like, right here. And I'm like, okay, I'll show you that whenever we get out of here. And so I showed her the pictures and she was amazed. And it was a little bit disconcerting because there shouldn't be inflammation in one spot that looks kind of square.
Yeah.
And if it was just heat from the instrument, the phone itself.
Totally possible still.
How long would it take for that heat to dissipate?
Sure.
I would say it shouldn't be long. It should be hopefully.
She had already had it off of her body for 15 minutes.
Yeah.
And that was still there.
Thank you. That's what I wanted you to say, because the reality is that'll be the excuse that some people out there, the naysayers, will say.
Yeah.
Is that, that was just the phone generates heat by the electrical energy it's giving off. And so if it's there, it's like a thermal, it just increases that. But it should go back to normal within 15 minutes. That's why the proper use in science behind thermography has a acclimation time period. You don't walk in from the street in the sun in, sitting in your car and one side's in the sun and one side's not. And then immediately, okay, take your shirt off and get in front of the camera. And 1 minute after you
15
walk,
minutes you're sitting
get out
there
of your car. No.
before you ever get the picture taken. And your autonomic nervous system works that fast. It's doing the blinking and the, all the getting adjusted to the temperature quickly. And it should have done that equally.
I love that you said autonomic nervous system, because I love doing heart rate variability studies and seeing where people are. I had a crazy situation with a woman, just autonomic nervous system and inflammation and just health problems like joint pain, different things like that. And things that her husband's going through, though he kept saying, joking during consult, like, it distresses me. And she's like, no, you're not. No, you don't stress me. Found out what he was going through. It wasn't a stress in the way of like, you're frustrating me, you're angering me type stress that most women would say, you stress me because of frustration, right? But it was heartache. It was watching the man she loves, go through something difficult. That's stress.
Totally.
So, but her autonomic nervous system showed up that she was under stress, despite her loving mind wanting to tell the husband, no, you don't stress me.
Yeah.
Though her heartache for what he's experiencing is stressful.
Yep.
Yeah.
So it's still a negative impact. But questions. Let's hit some of those.
Would this help detect inflammatory breast cancer at early stages, since mammograms do not pick that up?
It's a really great question. And again, I have to say that it doesn't detect cancer. But with that being inflammatory breast cancer, and inflammation being the thing that the thermal camera picks up and looks at, I could at least say there's a really great chance that you could see some difference in blood perfusion and difference in inflammation with that.
Yeah, absolutely.
Ashley, did you send me the Google search link? Yeah. See, I just typed it into PubMed. Actually, I had Ashley. Don't want to, get credit for something I didn't do. I told Ashley, hey, type this into PubMed real quick, and let's look at inflammatory breast cancer and inflammatory conditions. And so if it is inflammatory, it's extremely, extremely likely that you're going to have vascular, and inflammation comes with heat. You twist your ankle, it's an inflammatory process taking place. It feels hotter to the touch. An infection has inflammation, and the inflammation is part of why it's hotter. So there's also a natural during infection and fever type effect that even happens locally. But what was interesting to me was the second hit on this search was a 2018 study, the evaluation of acute skin toxicity of breast radiotherapy using thermography. So literally, the radiotherapy is radiation therapy for breast cancer. They use thermography to assess the amount of inflammation and toxicity to the tissues of your breast with thermography. Like, how much damage is the treatment doing inflammation-wise? In which, actually, if you study chemo and radiation, their goals are inflammation. It's inflammation to chemo, rapidly growing and developing cells. That's why mucosal membranes, vaginal tract, intestinal tract, sinuses, hair, all those things are extremely damaged by chemotherapy because it creates inflammation and damage and cellular death to those tissues, including rapidly growing cancer cells. But if the cancer isn't rapidly growing, chemo doesn't work. That's what a lot of people are told. And then with radiation, it's the same thing. It's more localized. They want to generate localized tissue destruction is what they want to do. And you're going to have bystander impact to healthy tissues. And that's what's sad about these therapies. Should only be seen. I think I was talking on Friday about it. But I love an article that it talks about they should be used, if they're going to be used, they should be used to buy time. Buy you time for the completion of healing. But you got to figure out why you're not able to heal appropriately.
Yeah.
Yep, exactly. So, yes, I would be like, yes, that would be like the perfect scenario. That would be a godsend for somebody with, God forbid, inflammatory breast cancer developing in their system that goes in for mammogram, and they're like, thumbs up, you're good to go. You don't have any tumors in your breast. But I thought mammography screening was supposed to detect breast cancer, they thought.
Right.
So they thought they were good to go, had nothing, no disease process in their breast tissue, and they go home and live their lifestyle exactly the same, yet they have an inflammatory process that is extremely deadly to men and women.
Mm-hmm.
So,
Yeah. How much does thermography cost? For a breast study alone, it's $195. For a breast study plus, which adds in the dental and the thyroid, it's $270. The reason I like that one, the breast study plus, is because there are a lot of times, I'm going to have pictures of somebody having something going on in their dental that they didn't realize that was super inflammatory, and it shows up in their thyroid and it shows up in the breast. And then you clear the dental work, you go have whatever work you need done. The inflammation clears up in the dental and the thyroid and the breast.
wow.
So, since it's all connected, that's a great one. The next one up is a half body study that adds in the abdomen and the lower back. And the full body study adds in arms and legs. And what I have to say about the full body study is that unless you have something going on in your arms and legs that you really want to see, there's not as much actionable information you can get from that one. But I mean, doc might get more information from it than the normal person.
I was going to pull up, since you're talking about cost, I always like to do a compare and contrast, but I don't know why I'm not pulling it up very quickly. But I have one on thermography, and it talks about like the harms of radiation, mammography causing breast cancer. So the problem with that, in that women were asking and requesting that they could get thermography or they could get MRIs that would be no radiation except for EMF. But that being said, it was like $2,000 for, MRIs. It was like, I forget how many, $1,000 or whatever. It was like for mammography on average, like your insurance, or several $100s.
Right.
And so a couple $100, yes, it's cash, but collectively, if we look at the grand scheme of things, if we all started doing this and we did testing that was less expensive, even when our insurance, then they're going to start paying for it. You know what I mean? They're going to say, well, we've got to go where the crowd is going. And if we don't generate a crowd removing themselves from a system that is not benefiting people in terms of true benefit, overall collective benefit, again, a mammography screening could light a fire underneath somebody's ass. Sorry, I said anus. Underneath their donkey, and they actually move in the direction of changing their lifestyle. I'm saying that's really the only time mammography screening saves lives, is when it initiates somebody to change their ways in terms of their lifestyle. But yeah, the cost is way, way less, like extremely less. And in that study, they said it was like a 97% efficacy to detect and determine the signals, like basically like they have an algorithm and like they grade you on levels. And so the grading system was 97% effective at finding and determining that they were likely to have breast cancer 97% of the time in women who had already had a mammogram detect breast cancer. So they'd already been determined to have breast cancer, and then they did blinded screening to see if the thermography screener could detect that, and they did. So so in essence, it's 97%. But again, but then people are like, well, that's 97. It misses the 3% of women who had breast cancer that mammography would have screened. But mammography is not 100% because it's not 100% for the inflammatory breast cancer. Do you follow me? And when you study angiogenesis, the blood vessel formation, you would have that potential to detect the development of breast cancer before it's even capable of being diagnosed as breast cancer, because you have to have blood vascular changes before a tumor can go from basically like the head of a ballpoint pen, like the ball inside of a ballpoint pen. That's about as big as it can get until it changes and it channels blood vessels into that region because it's higher metabolism. So it's a very metabolic disease process, and it needs more blood flow to be able to grow exponentially. So it can't grow exponentially without that blood flow. So the blood flow has to change before it can grow exponentially, and has to grow exponentially to a tumor before it's detectable in mammography screening.
That really sounded like a Dr. Zeus spill. Like just. Sorry.
Legit.
I mean, that's like the concept.
No, I totally get it.
You just had to make fun of me.
Well,
No, I'm kidding.
You're good.
Put you on the spot.
But also because I just saw something pop up in here, and you briefly touched on it, and he briefly touched on it, but it wasn't a direct answer, and sometimes people like a direct answer.
Okay.
Does insurance cover it?
Not usually.
Not usually.
I've had it covered once, and it was not through a major insurance company. It was through a medical sharing company.
Yeah.
Like a MediShare?
It wasn't MediShare. It was
Samaritan or
Liberty.
Healthcare.
Liberty.
Okay.
And then then they didn't cover it. For
That would
somebody
be
else in
cool.
Liberty.
You know, we ran into her at the Nashville Praise and Worship. Let us worship on our Sunday night. So maybe we need to push MediShare and those other organizations to realize that. Do you want to take part in causing women to get breast cancer by paying for a mammography? Look at the science. Maybe we need to start trying to petition them.
Come on.
All right, Christians.
Let's do it.
Okay, so we can always post those costs because we are going to be hosting Joanna here on October 28th. I think that's the day. It's Wednesday.
Yeah.
It's the last Wednesday of the month.
Yeah.
October 28th. That's the right day? Yeah. She'll be here hanging out in the office all day.
Yeah.
So,
and I am going to do a discount. I might need to know what that is. Wild Doc 2020. Okay. So for $30 off of whatever
Oh my God,
study
I
you
don't
choose.
want Wild Doc connected to 2020 right now.
My bad.
Don't connect me to 2020.
You're here.
I'm just kidding.
So if you're on Facebook, click the link.
yeah, so if you're on Facebook, click the link.
If you're on Instagram, swipe up.
If you're on Instagram, swipe up. I'm just telling me
Doing
what
great.
our person tells me.
And I didn't interrupt you too.
You're good.
So is it the Wild Doc?
No, it's just
2020?
Wild Doc
Wild
2020.
Doc.
Yeah.
So enter that code in, and if you click the link, we're at the bottom, Clarksville. Click that, and then you can pick what study, and then pick your time, and hurry up, because I'm going to schedule mine.
I do want you to touch, just because I'm a chiropractor and I'm biased. I would like, you said something about a client coming in, getting testing, and then went through chiropractic care. What did you see different?
So she came in and was inflamed. She had a lot of inflammation through her neck.
Cervicals.
Was probably, she was adjusted in her cervicals, but I think that it was also lymphatic congestion. And she went and did an adjustment the next day. I took another picture of her because she was really inflamed, and I was like, "Hey, if you want to come back in after your adjustment,
let's figure out what's going on."
Yeah. And she came back in, and she was nearly clear. Like
Nice.
the only thing I saw were the veins and the carotid and the jugular.
Yeah.
Like that should be warm.
Nice. That's
So
cool.
It was good.
And the reason that would be, and this is why I tell people people would be like, "Oh, I have sinus congestion. I have a child with an ear infection, or it's inflamed in the ear, and they don't know whether it's bacterial or viral. They never test for that. So that's why that's why the AAP said, don't take an antibiotic for an ear infection. Don't give it for an ear infection. But the reality is we can adjust a lot of times, and all of a sudden, like the next day, it's like cleared up. Like it happens extremely quick, very, very frequently. And it is the spine. If you look at the lymph system on a diagram of the human body, anatomy, it channels from the exterior, channels from your extremities into and around the spine. The spine was supposed to be an area of the body that is extremely mobile, and you have to move to enable lymph system drainage. And if it's not moving appropriately, or if there's subluxations, misalignments causing either vascular changes, inflammatory responses, neurogenic inflammation that can cause swelling and disruption of the lymph system. And so if you adjust, you can help all of those factors. And exactly which one of those factors with every single patient, I never am fully aware. I never get to test. That's why I would love that. It would be really super cool to be like thermography, adjustment, 15 minutes later, thermography again. I think it would be super cool.
Yeah.
And the 270 covers the breast plus, right?
Mm-hmm.
Okay, so
Yeah.
270, and then 30 off of that is 240. 240. Sorry.
You're good.
Let's see if there's anything on here really quick.
Do you see the Celeste one?
Okay, there's
See
a
a couple of
couple.
them.
Yeah.
So what reason would cause... I like that question.
What reason would cause me to go get thermography? And then if there's something in the breast, what is the next step? Will they make you get a mammogram? That is a good question.
Oh, no.
We don't make you do anything.
Yeah.
We give you information and enlighten you to what's going on with your body or the potential things that could be going on with your body. And there are certain types of conditions and inflammatory process and signals, we'll call them, on that that scan that could say you may be looking at cancer. You know what I mean? And there's times when you have to say, hey, with this finding, am I right?
Yeah.
You need to go get further evaluation.
Yes.
One, for a legal standpoint, you have to suggest that. You have to recommend that,
Mhm.
encourage them to go in that direction. But then you can also say, hey, in the meantime, while they're trying to figure out if you're potentially at an end-stage condition like cancer,
Right.
why don't we can
Here are the
say,
lifestyle changes.
let's get these other lifestyle changes going. And then I would say if it's a strong enough signal like that, I would be like, let's get additional testing to figure out why you could be there, why you might be there looking at cancer. And, that'd be a strong fire underneath somebody's rear end.
Yeah,
You know.
absolutely.
But you're not forced. You don't have to do anything. Like literally, you could go get a mammogram and they could be like, you have cancer, and you don't have to do anything.
Right.
You have the choice over your own human body. No one else has that control over you. And that's what in hearing her say that, that's what almost kind of breaks my heart, and it makes me sad that people really do this day and age think that once they're well, my insurance makes me do it, or my doctor says I have to do it. I have to. You don't have to do anything. You don't even have to see a doctor.
We've lost the art of knowing that we are in control of our bodies, and that's not just in this situation. That's in a lot. But you are able to say no to anything that you do not agree with, or think you might want to. I don't know. Maybe go home and research it. And it's the treatment is pushed like immediate. Let's do it. Let's do it now. And you don't have to. You can go home and think about it.
Yep.
Pray about it.
And
do whatever you need to do in order to feel comfortable.
I give my patients permission to say no to me all the time, especially when I'm talking about them doing some homework, lifestyle changes. I say, listen, I'm going to give you recommendations on lifestyle changes and homework. And if you don't want to do that, that's fine. You can say no to me. Not that you need my permission. I'll just make more money on you because then you're relying on me to do all that.
Well, that too. She also did mention if you don't get screenings, will insurance not cover you if you need some kind of treatment?
No, they can't do that.
No.
That's not legal. Like, it's
Yeah.
not legal that they would do that.
And not to mention, mammography does not
Rule out
Right.
the possibility of cancer. It
Right.
potentially rules things in, but doesn't rule out the potential of cancer. The majority of people that I talk with, when I talk to groups, especially about breast cancer in the month of October in the past, especially, it'd be like, how many of you got it detected by your annual mammogram? And like a few might raise their hand. How many of you got your annual mammogram and nothing was found, and then 3 months later you felt something going on in your breast tissue and went in and got another mammogram and there it was?
Right.
And yet 3 months prior, nothing was found. I hear that all the time.
Right.
Yeah.
Because it's not like it grows at this, if we do it a year, we're always going to detect. No.
Yeah.
And that's one of the big, when you read the research, they say one of the biggest problems with mammography screening is invasive type breast cancers especially grow so quickly that detecting it, doing it every year is really worthless.
Right.
It really is.
And what we do for women is have them come in, do this first screening, and then suggest 3 or 6 months just to get a baseline picture so we can see how fast something's growing. Because if we went from 1 year to the next year, we would have no idea how fast or slow anything was moving metabolically in your body.
Yeah.
But if you do it here, again, and I do that one for way less, it's 160 and it's just the breast study, but I just want you to get the pictures.
Yeah.
But when we do that from here to here, then we see, okay, things are looking actually better. Awesome, usually. Because we've already given them some lifestyle suggestions.
The people that come to you usually are mindset already there.
Absolutely.
And that's what's awesome.
Yeah.
Because it's not like somebody that comes like they would for their annual mammogram.
Right.
It's just flip-flopped. And if the same mindset walked in your door and did that and didn't do any, they wouldn't get those results. It's not like thermography gets you the results.
No.
Right.
It's just because these people are more likely to do the stuff.
Right.
Yes.
So,
Yeah.
I was going to say too, you were going to talk about mammography and implants.
Yeah. When we were talking about, she had showed me a picture right before we started here of the woman that she was talking about that had her implants taken out and the inflammation before. before explant and then the difference after explant. But one of the things that a lot of women don't realize whenever they have implants is that they should not be getting mammograms. It squishes your boobies. It's not exactly an ideal situation for somebody that has an implant that could rupture in their body. So that's not a good route to choose if you have implants. And a lot of women just don't realize that. Maybe they got their implants 20 years ago, and that just wasn't a thought in their mind because they were 20 and now they're 40 and now they're of age that they think that they want to, or their doctor has recommended you are now of breast cancer screening age. And they don't think to ask those questions. And half the time their provider doesn't even know that they have implants.
Right.
And then they go in for a mammogram and then bam, you've got a ruptured implant. You don't realize you have a ruptured implant because you may not feel it. We have
client and neighbor.
Yeah, we have a friend, neighbor, client, patient, whatever you want to call her. We love her.
She's this, that, and other.
She's all the things.
Babysitter.
But she just got her implants after I talked so much about mine. She ended up getting hers out before me because I had to wait till I was done.
Ran out and got it done.
Yeah, she went out and got it done, and both of her implants were ruptured.
Yeah, which is great that she
both
ran
of
out and got
them,
it done.
and she had no idea. So women are going out and they're getting this procedure done, and they're not really fully comprehending that that is something that can harm that structure in their body that should be removed anyways. But
and she's talking about kind of two procedures there. One getting put in, and two being the mammography that can compress and squish and destroy
and
rupture your breast implant.
And then you not understand, and then you fall crazy ill, and because your body is literally absorbing all of this chemical compound that is within the breast tissue, and it's just downhill from there. So that's just my spill. If you have implants.
And I've literally heard women say that, well, I was told I need mammograms more often with implants because it's harder to detect.
They got to squish a little more.
And then, well, aren't you at higher risk of cancer because you have breast implants? So shouldn't it be more reason to get mammograms? So I've seen and heard all kinds of arguments for that. Right. Somebody asked here, would calcium deposits or fibroids be something that would produce enough heat to show up on thermography?
It depends on how big they are. I've seen where a calcium deposit did show up, and then another time that there was obviously a calcium deposit. Like you could feel the hard space, and it didn't show up at all. So it's kind of a toss-up.
What I would say is how inflamed are those at that moment in time? So how active, inflamed are they? And that's where I've read some really cool studies about just simple things done. Coffee removal to green tea extract, reducing breast tenderness and pain, which would be an indication of less inflammation. But I bet you if somebody's severely inflamed and they're extremely tender, they'd probably pick up, and then maybe even times of the month and things like that, they could pick up more because some of that inflammation in fibrocystic breast tissue and things like that can be more tender and inflamed during times of the month and during dietary factors and things like that.
And then 70% of your lymphatic system comes through your breasts also. So also clearing out your lymph system. I say that all the time, but there's no pump for the lymph.
Yeah.
You are the pump for the lymph, which is what you said earlier. So there's a heart that pumps the blood, but the lymph just sits there unless you move. Or move it.
Yep.
So
compress release from contraction of your muscles and movement of your joints. It's really how it works. And I mean, obviously, lymph drainage techniques like dry brushing and massage and different things. So,
I need to whip out our dry brushes at home. They've been
pull them out.
Yeah,
they've been in the drawer for some time now. I should probably get on that.
But I think
that's all the questions on there. I think so far, yeah. But we still have
no.
Oh no.
I mean, well, maybe it is replying to somebody. I mean, would an oncologist then make you get a memory? Yeah,
she was
in regards to if we found something with thermography, would we make her go to an oncologist? No.
Or
you have the freedom.
No, I think she's saying if she ended up at an oncologist and she did in fact have breast cancer, would they be like, well, now that we can see that you have breast cancer, are they gonna almost like a
make you go through treatments?
Yeah, make you go through that process of actually doing the mammogram, see if it's there, That's kind of what it sounds like to me, like almost like a double back in order to get the treatment.
Yeah. So,
Type of thing.
Joanna, another person's asking, with the full body one, can you still get a good read on the breast? So, so let them know what the full body means.
So the full body
It's not
is...
like you're doing a picture from head to toe, all the exact same snap of the picture.
I'm doing the same exact pictures that I would in the breast study, and then we add in the pictures that we do for the dental and thyroid, and then we add in the pictures that we would do for the abdomen. So it's just several different pictures, and they're all at the same distance that they would be.
So like dental, you may pick up like an abscess or something like that, some inflammatory type possible infection or things like that. With the abdomen, you may be looking, if it's really bad, inflammatory bowel disorder or like a Crohn's disease type effect going on, that type of thing.
Yeah.
So kind of cool to be like, eat this and let's do a thermography, and then eat this, eat some pizza, and let's watch what happens to your gut. And
I did
show you why you feel
have a friend come in, and he had eaten several nasty things because he has a pretty clean diet, and he was actually just trying to see if his product would help clean stuff up. And the product that he sells, and I mean, he must have eaten horrible because his gut actually looks super inflamed, and I was like, what have you been doing? And
eating the standard American diet.
Basically, he's like, I had fries for lunch, and I was like, oh, okay.
What do you mean? I mean, I'm eating what the American Heart Association tells me to eat: grains. Yeah, it's my foundation. Why is your gut so inflamed? Because I listen to the government for my health advice. What is recommended in thermo? Is not an option for someone with implants.
So what is recommended if thermography is not an option for someone with implants?
It is an option for someone with implants.
Yeah, it is an option.
I guess they're talking like if they don't have access, I bet. They don't have anyone in their area. Because I know some places are like, they'd have to drive hours. You know, you think somewhere in Montana and South Dakota, maybe, might have to drive several hours. So I don't know if that's per se, maybe give us Kanji, maybe give us a little bit more details on why it would not be an option for somebody with implants. It definitely is an option for them. It's probably a great option for them. But again, if it's not in their area or they can't get access to a thermography center or an individual who provides that service, then what would be alternatives really?
Breast checks.
What's that?
Like breast checks yourself.
Self breast check. Yeah,
which really you should be doing monthly anyway.
Yeah.
It wasn't until I got this really cool tool called my breast friend, which I didn't bring today.
Breast friend?
My breast friend. And it's just this little, I know, hysterical.
Can I see my breast friends today?
Wrong.
I tried to tell my wife.
And it's just this little.
Sorry.
I love it. It's this little thing that you set up against yourself, and you like practice. It's got little simulations of tumor bits in there. And so you like practice and see how that feels to try to find it. And then you try it on yourself. It's super cool. But until I had that, I just didn't even do it. I mean, I'm being super honest here.
No,
like,
I've never really.
Because I was like,
oh, cool. That's what
whatever.
it would feel like. So I'm going to make sure.
Yeah.
Because otherwise you're just like,
and to do it,
feeling
if you do it every month, right?
The actual understanding of what you're feeling for.
Yeah, and if you do it every month, you get used to feeling what you feel like, and so then you realize if something's actually out of place, as opposed to waiting till something's like big enough to it to be a problem.
Well, maybe y'all buy me one of those things, and I can play with that, and then I can make sure I do real exams on you instead of always jokingly saying the doctor's orders. You need an exam.
Wow.
This is all happening.
Yeah, it's all.
It's all on camera.
There's always something.
So glad.
Yeah.
Laughter is the best medicine, everybody.
He
I
has
give it
no
out freely.
filter.
That's awesome.
It's a healthy relationship.
Yeah, right.
That's how you stay married.
Yeah. Okay, so do we want to touch on these last two right here?
Which ones? It's amazing. That was somebody talking back and forth with Joanna a little bit. About the before and after pictures.
Which we kind of touched on.
Yeah.
And then I'm so grateful for this. I declined my mammogram because radiation exposure in the area where I'm trying to prevent breast cancer or cancer just didn't make sense to me. I need to get more information before making a decision. Yes. It just comes down to study. Do you have a website where you've got good information?
I do not have the studies attached there, but I will because you're Mr. Study.
I love studies. what I tell people is like through the Wellness Way and what we do and what I've always done is try to validate what I'm saying with their own words. Like legitimately saying that breast cancer screening with mammography doesn't work, and work is by definition create a dynamic, and it's not a system that extends the lives of people. It causes breast cancer. It causes more women to develop breast cancer than what the science says would be saved by mammography. They both end in ography, so it's like
which one? I can't say though from an FDA perspective that you can do this instead of. I can say that you can do it in addition as an adjunct.
Yep.
Yes.
We're supposed to make sure that we don't talk negatively about there. But you could go to the National Cancer Institute here and you could read about why early detection is a complete bogus myth when it comes to the way in which we're detecting cancer. Because again, mammography detects end-stage disease. So you are full-blown in cancer for that test to come positive. It doesn't tell you if you're having vascular changes that could lead to the explosion of breast cancer tumor growth in the next couple months. But you could be getting a mammogram, getting radiation to a microscopic cancer tissue in your breast, and the vascular changes haven't occurred or already occurred. That's what the dynamic I was actually wanting to explain, which thermography would pick that up. Those vascular changes has a high likelihood, extreme high likelihood of picking that up. That occurrence, that disease process is in the development, and a mammogram says nothing's wrong, and a thermography screening would say, no, vascular changes are occurring. Something is going on. That's really what it comes down to. Something inflammatory, something vascular, some imbalance is taking place. We need to figure out why that is taking place. And again, the lack of radiation and chemotherapy in your bloodstream is not the cause of why you're imbalanced and you have cancer in the first place. But even the National Cancer Institute, literally on their website, explains why early detection is a myth. And early detection can be extremely beneficial if we didn't go about it in the mindset of, oh, I just have cancer and I'm unlucky, and therefore if you just give me chemo radiation and cut my breast off, then I'm all better and I do nothing, and then the environment that allows cancer to develop is still there. Thus, why is breast cancer mortality gone down very slightly, but lung cancer mortality has gone up even more drastically during a time period when smoking is declined? So it's like it's just great information. Like they talk about why 5-year survival is a bogus terminology. Like the National Cancer Institute, our government, thankfully, actually explains this, but nobody reads this, and doctors don't explain it. So again, it's not a detection for cancer. It's a detection for a possibility of an imbalance that could be indicating the potential for your body to develop cancer now or in the future.
And one question was, why would I come in? For thermography? And I would just say, it doesn't really matter how old you are. You can do this at any age. Because it doesn't adjust your DNA. But I would also say, if you're coming in with the, like a lot of people come in and they're super stressed out and they're like nearly in tears by the time we're doing this. And I'm like, oh, okay. Your body is full of inflammatory cytokines right now because you are freaking out. We're going to just take this down for a second, and because that picture is going to look weird anyway. So let's just calm down and figure this out. Maybe we'll pray. Let's just
people can turn red when they're frustrated.
And they've just hyped themselves up so much, like I might see cancer. And I'm just saying, come in. Let's just see the picture, because chances are you're probably great. And I just want to, let's just get as much information in your hands as possible and connect you with the right doctors to help you get healthier.
Well, and
that's what it's for.
That's probably, I would imagine, kind of like the difference, because people maybe. But, because that's, if you were to go in for a mammogram, that is what you're anticipating. You are anticipating a negative response and all these procedures thrown at you, and that is the core fear of going in for a mammogram. is that, like that is what's going to happen. That is going to happen to me. That's the core fear. And then going in for thermography in place. And that's why you say it's not in place of, it's just to see where you're at. In addition to, or,
Period.
yes.
Do whatever.
But that's not the point. It's a very different approach to that. It's not a, you have breast cancer, now go get treatment. It's, hey, we're seeing some inflammation. What sort of things can we do in your lifestyle and your diet to change that?
Yeah.
So this may kind of give an understanding. I like the question and I like the way you answered it. And I was almost like, let's play out the scenarios real quick. Because one of the things I was saying is really you should be looking at this type of test as being something to determine that you're on the top of your game.
Yes.
You know what I mean? You're playing at your best. You're doing your best. You know what I mean? Is the vacation meals that you think is okay of once a week or every other day, depending on what you think is an okay vacation meal, or it's just like, I'm so healthy, I can cheat and eat unhealthy so many XYZ times a week or day or whatever. If you thought it was okay to do it daily, it would be bad. But just mammograms. So it says that for every 2,000 women invited to screening for 10 years, one would avoid dying from breast cancer. But 10 healthy women, now that's not actually true because likelihood that 10 women probably have other problems, health problems. But 10 healthy women would not have been diagnosed and would have been treated unnecessarily. So you have a 90% chance of being treated unnecessarily for breast cancer by going to mammograms. And you have in essence, like you said, okay, 10 healthy women would be treated unnecessarily, and then one woman would have their life extended. So then they got 10 women saying, I was cured of my cancer, but actually you were actually only harmed, and they stole your money, and they put you through horrific treatments when you were harmed, not benefited by mammography screening. And that's the problem with that type of screening, and it's the problem with the mindset they're approaching cancer in the first place, disease process in the first place. Yes. They're approaching the restoration of health with the wrong perspective and mindset, and that's the problem. So in essence, let's play out maybe a couple scenarios, and then we'll kind of wrap this up, I think, since we're about an hour. So somebody comes in, and you have, different scenarios. One, it's all clear. Two, and I guess there's only two scenarios. It's clear and it's not clear.
Basically.
Right? Basically, it's clear and it's not clear.
Or it looks really rough.
That would be it's not clear and there's minimal inflammatory signals or heat signals. And then there's extreme heat signals.
Sure.
So, because this is something that I've had a lot of women, because it's like for years I have led women down the path of reading the research about the harms of mammography screening, about the harms of radiation repetitively to your breast tissue that causes cancer. When they learn that, they're like, okay, I don't want mammogram, but what do I do?
Yeah.
And for a long time, I was like, there is thermography, but I didn't really get involved in it. It was just something I didn't do. So I was like, you got to find it. So it was just kind of like, okay, now I've got to go out, venture out on their own. And then it was always fear for me, because sometimes I was like, yeah, there's thermography, but thermography could lead you down the same harmful path that mammography leads you down, and not finding the underlying cause of why there's an imbalance in your body. Why you have a disease process, an inflammatory process, a vascular process. So that being said, it was always kind of like I would be wishy-washy of even encouraging them on thermography, because I was like, I don't know who you're going to go to. So I'm so glad we made connection, and I'm looking forward to the lives that can be positively changed in the future through this. And that's the reality of it is, while some would say that mammography possibly changed their life in the right direction because they found cancer and it saved their life, again, I would always kind of I hesitate in saying it, but the reality is, just like this Cochrane database of systematic reviews, gold standard medical review boards, literally saying that 10 women, you're more likely to be a part of the 10 women that was harmed unnecessarily by mammography screening, put through treatments that were unnecessary, never necessary. And with the percentage of women going into spontaneous remission, regression of breast cancer on their own, without ever any testing, any procedures, any modification of lifestyle, which, a whole nother rigmarole discussion we could have there. But it's just sad, because there's this popularity craze about, and this that used to be stronger than it is now, luckily we have people like yourself actually educating people about the benefits of a non-harmful detection method. Detection, not breast cancer detection of imbalance. And it's better to detect the imbalance and then figure out why, and then take the path to true health and wellness rather than a detection of full-blown cancer. And increase your odds of cancer in the process. So that's really, in a nutshell, it's not really, that's a pretty large nutshell, but any other quick questions or comments, I guess, that Ashley you've seen or anything like that?
Me?
You guys are keeping up with them.
Okay. Yeah, cool.
I'm rocking it.
Yvonne says you're awesome. I don't know if she's talking about me or
She's talking about me.
ladies. Yeah, probably.
She's talking about her.
No.
She's like, shut up.
You.
So cool. I think we're good. Any quick
Yeah.
thoughts or comments? And
I'm just excited.
probably when you're up
Yeah.
here, if we had a break, we probably should go live one more time.
Totally.
Maybe on the
If I have a
28th or
break,
something.
we'll do
like
it.
that. I know.
Yes.
Hopefully, you're just leaving
Hopefully you're
everybody.
popping.
It's kind of like that other scenario. It's hopefully you're just giving 2 thumbs up and
Yeah.
looks amazing.
Yeah.
Yes. And you look
That's always
good.
my heart.
You're at the top of your game. You're obviously under White Wellness Way Care or living a great.
I have a quick
lifestyle.
question
Yeah.
that maybe somebody else might have, like as a mother, and you briefly talked about it, like any age. It's obviously not radiation, but for parents that, especially parents that do live a more natural lifestyle, I think sometimes there's a little apprehension with their kids, like, do I take them somewhere? I think there might be something going on, but I'm kind of scared to take them anywhere because what if there is something going on, and am I going to get pressured and blah, 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 blah. It's a whole thing. It's a whole rabbit hole. So that being said, are kids an option? And have you, what have you seen with that really quickly before we get off? Because I think that's a good one.
Yeah, that's great. I have 4 kids.
Yeah.
They're 18 to 8.
Yeah.
And so I have a major mama's heart on this
Yeah.
subject. It's totally safe. I've actually only had 2 kids come my way besides my own children.
Yeah.
And my only thing is it needs to be appropriate for that child, because that could also just be a little bit scarring. Because if it's a boy, no big deal. You have on your shorts in front of this different lady who is not your mama. But your mom can obviously be in there.
Yeah.
Your parent,
but
the parent would be
the
there
parents,
and
yes,
is
absolutely.
anytime you're doing.
Yes.
Yeah.
But also if it was a little girl, it just kind of, it all just depends on what your child has going on.
Yeah.
And we are going to be, the mom and dad and I will be talking about what's actually best for this kid, whether or not that's even
And I would talk about with a little girl or a
Psychological.
little child that this is not appropriate.
for anyone.
Anyone
And
to
I'm
be
on a
doing
different
outside
side of
of-
the screen. If
Yeah.
the mama can be on the same side of the screen,
Yeah.
they can't even really see me, but they're standing there in front of a camera.
Show the
So,
kids the camera and
Yeah.
the pictures and stuff like that. That it's not actually a picture of
Right.
the child's face, not a
Yes.
picture of the child's body. It's not going
Right.
to be used,
Yeah.
because nowadays, God forbid,
Yes,
stuff
absolutely.
that takes place.
So
with
that's
kids.
my only thing.
Yeah.
But if you,
Thanks for
I'm
clarifying that.
absolutely.
That's kind of a thought
Um,
process that probably a lot of,
I'm
Yeah,
just the
imagine.
mama.
Yeah, but I just even thought about just because we
But
have,
yes.
sugar bugs and
Yeah.
in the teeth and
Sure.
just
Like you think
what,
more like the dental type
yeah,
for our
absolutely,
kiddos and stuff
absolutely,
like that. Yeah.
Yeah.
I think we would do
what
that.
sort of
Be game to do that.
Mm-hmm.
and what dry brushing looks like for little
Yes.
kids,
Yeah.
and I think that's
Super smart.
Yeah.
a whole
way.
cool thing that
Yeah.
just kind of popped into my head, and
I
I
love
just thought that maybe other moms might be interested in that.
Yeah.
So
And any pictures that I do only go to you. And
Yeah.
whatever doctor you want them to go to.
Yeah.
And that's
Gotcha.
the only 2 places they go.
Gotcha. And I think with kiddos, for me, it would be as I've told you before, I've always said, if I do testing and stuff like that, whether it be dental and stuff like that, I'm always what do I say? I say, if a test comes positive, it's almost more ego hurting than anything else, because I'm I'm not doing enough for my kids. I should be being a better parent. And granted, there are circumstances where it's outside of the parental control for where their child's health is in that moment in time, because of past things the parent's been taught, past things the parent's been told they have to do, all this kind of stuff, that then the child's health succumb to an issue or the child developed an issue outside of the parent's true control. But in my situation, it's kind of like in our situation, it's like, hey, it can be. Are we at the top of our game? Right. And I think that's why we would do a scan.
Yeah, absolutely.
It's just not about, we just don't do condemnation anyway. Like, that's not how we roll. So, like, most of the time I'm telling you, hey, it's okay. It's going to be fine. And we're just going to move to the next thing. So what's the next best thing?
Yeah, and that's awesome. And I think that would be super helpful and beneficial for, especially for moms that that do live this lifestyle and kind of are fearful to be put in a medical situation, period, and feeling like a shame. So I think that's great, and I knew that somebody would comment about it. Any recommendations for dry brushing kids and toddlers? Do you have like a website or like
I mean, I have a little on my Instagram. I mean, not really kids and toddlers. It's everybody. I would do it all the same.
Yeah. Okay. Okay. Great.
So I have a little Instagram how-to.
Awesome.
Video.
Very cool.
Yeah.
So
and
go to
kids,
Instagram.
like, you know, like let them.
Sozo Thermography.
Sozo Thermography.
It was like trampolines, as long as they don't get hurt. Trampolines.
Yes.
That's good for lymph system. Burying each other in the sandbox, as long as the cats are.
Hysterical.
And then, you know, it's like, you're gonna get dry brushing work. Is that because it's depression? Kids is like play. Like they need activity, movement, and that's like one of the best things. But that'd be cool to know what kind of dry brushing and stuff like that. And if they have, I'm thinking my wheels are spinning, but we can't go down that rabbit hole again.
Another day.
Yep. So
maybe if she has a break.
Well,
good.
Thank you all. Appreciate you all. Please do share this video because we are getting majorly censored by Facebook as they have this new algorithm and things like that. And supposedly I shared articles that were scientific or shared an article from the past that wasn't correct today, and that's false information. And, you know, because we read government research, and then I guess it's true because a lot of the government research out there is false. So I guess it's true. No, I'm kidding. But again, thank you so much. Looking forward to 28th. You know, we got details. You can call our office. You can get a hold of us anyway.
Click the link on Facebook. Swipe up on Instagram.
There
fill the spot.
Yep.
And it's going to be fun day.
Yeah,
absolutely.
It's gonna be cool. So thank you again for showing up
Yeah.
and giving us this beneficial information. Share the truth, y'all, because that's the way we're gonna save lives. Thank you. Love you.
Bye.